UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Glad to have you on board. Hey, if this is your first time checking us out, make sure you like and subscribe to the show. Today, if your healthcare provider has recommended intermittent catheterization for you, you probably have a lot of questions and maybe even a little anxiety. The good news is that the right technique and a few practical tips, intermittent catheterization can become a safe, comfortable, and routine part of your daily life. Today's episode, I'll share the secrets I've learned over the past 40 years of teaching people how to catheterize themselves. So I'm going to share those secrets to successful intermittent catheterization, from choosing the right supplies and preventing infections to making the process easier, more comfortable, and you more confident. So whether you're just getting started or looking for some tips to improve your technique, this episode is packed with lots of great practical advice to help you take control of your bladder health. So let's get started. Intermittent self-catheterization is a safe, effective way to empty your bladder when it cannot empty completely on its own. Although the idea of using a catheter may seem intimidating at first, most people find that with proper instruction and a little practice, the process becomes a simple part of their daily routine. Mastering ISC, as we like to call it, can help prevent urinary tract infections caused by retained urine, protect kidney health, reduce bladder discomfort, and give you greater confidence and independence. If you're wearing a Foley catheter, this episode is for you. In this guide, I'm going to walk you through each step of the procedure, share some tips to make catheterization easier and more comfortable, and answer some common questions patients usually have to help feel more prepared and in control of your bladder health. Now, first of all, you may need to perform intermittent catheterization if your bladder is not emptying on its own. This can happen for many reasons, including an enlarged prostate called BPH, nerve or spinal cord conditions, multiple sclerosis, diabetes-related bladder problems. Diabetes destroys nerves, including the ones that go to the bladder, stroke, pelvic surgery, or certain medications that can affect bladder function. Now, when urine remains in the bladder, it can lead to frequent urination. Sometimes patients will come into the office and they're not complaining they can't urinate. They're urinating all the time, but they're not emptying. Difficulty getting that stream started, leakage, bladder pressure discomfort, urinary tract infections, and in some cases, even kidney damage. It's got to be something you take care of because you don't want to damage your kidneys. Intermittent catheterization helps empty the bladder at regular intervals, reducing these risks and improving comfort, confidence, and quality of life. Now, before you begin intermittent catheterization, gather all the supplies you're going to need to make this procedure as clean, comfortable, and efficient as possible. These typically include a sterile or clean single-use catheter. There's some talk about reusable catheters, but right now the recommendation is single-use. Water-soluble lubricant if your catheter is not pre-lubricated. A couple different catheters are out there. Some you have to lubricate, some you don't. Some soap and water or hand sanitizer for hand hygiene, and some clean tissues or gauze to manage any small drips of urine. Some people also find it helpful to use a mirror, especially when learning the technique. This is my female patients, and have a clean container available if you're not catheterizing directly into the toilet. Your healthcare provider is going to help recommend the best catheter size, type, technique that's best for you. So they're going to give you that they should give you that hands-on training. Your provider should also recommend how often you should perform this procedure based on your bladder function, fluid intake, and the amount left in your bladder. General word of warning, you should try to catheterize often enough to keep your bladder volume below 500 cc's. That's half a liter or half a quart generally. That helps to prevent overstretching of the bladder and reduce the risk of urinary tract infections, leakage, and kidney problems. If you're unable to urinate on your own at all, that usually means you're going to be catheterizing 4 to 6 times a day. Although some people may need to do it more, some less. Again, depends on how much you're drinking. Your provider is going to should give you some measures about the amount of urine you drain for the first few days so your schedule can be adjusted to meet your individual needs. Now, here's the tricks. Before you put the catheter in, take a few moments to prepare your supplies using these 3 simple steps. Number 1, wash your hands thoroughly with soap and water, or use an alcohol-based hand sanitizer if soap and water are not available. All you need. You don't need to wear gloves. Good hand cleaning. Number 2, get your catheter open. Sometimes it's a little tricky to pull those things apart to open them up. So open the catheter without touching the part that's going to be inserted into your body to keep it as clean as possible. Number 3, lubricate the catheter. Now, if it's a pre-lubricated catheter, it may have some mechanism for lubricating itself. We're not going into all the different catheters today. We're just going into tips and tricks. If it's not, then a little lubricant on a clean paper towel or something works just fine to run it through. And I'll talk to you a little bit about that in an example I'm going to give. Never use petroleum jelly or oil-based products. Should be water-soluble lubricant. And you want to lubricate most of the catheter so that it goes in, as they can damage. I was talking about the oil-based products can damage the catheter. So these are the 3 steps to get ready. Now let's talk about the guide to doing the catheterization. So first of all, let's talk about a little bit for the males about anatomy and positioning. So for men, begin by positioning yourself in a way that's most comfortable for you. Most men find it easier to do it standing, but you can do this sitting or laying. But the easiest, I think, for most men is standing. Now, you want to grasp the penis and hold it at about a 90-degree angle. Now, the reason we're doing that is you can see there's 2 curves here in our natural anatomy. That one curve is by the prostate. You can't do anything about that curve. It's there. But the second curve is right here, and that's from the normal way the penis wants to lay. But if you bend it open, like you see here in the picture, you get rid of that curve. One less curve to have to navigate. So do that. This position helps straighten the urethra, making catheter insertion smoother and more comfortable. Now here's a hint. If you're uncircumcised, gently retract the foreskin before cleaning. Use soap and water or another cleansing method around the tip of the penis to clean that off in a circular motion. Now, if you are not circumcised and you have to pull back that foreskin, remember to pull it back over the head of the penis, because you can get a lot of swelling. We talked about that in the previous episode. So definitely take care of that. All right, now here's the technique. Gently insert the lubricated catheter into the urethra and slowly advance it about 6 to 8 inches or until the urine starts to flow. I always like to push it a little past once I see the urine flow. As the catheter passes through the area of the prostate, you might feel some mild resistance. This is common. Don't force, relax. There's a muscle in there called the sphincter that you can actually physically tighten. And if you're tightening your sphincter, now you're pushing against the closed muscle. You want that muscle to be relaxed. You don't have to do anything to make it relax except try not to tighten. All right. Now, if you consistently have trouble passing a catheter, talk to your healthcare provider about a Coude catheter, like you see there on the bottom of the picture. It's got a little curve on it. That curve helps negotiate that curve inside that I talked to you about by the prostate. So instead of hitting it with a blunt end, it hits it with the curve and kind of makes it easier to go up. I always say that should be the last resort. I find that if you just use a regular catheter that goes in, it's easier, because with these curved catheters, they do have a marking to tell you which way they're aimed. But once they're in, they're kind of hard to tell which way they're going, and people can put them in backwards and makes it even harder. So once you get in and you start seeing urine passing through it, let it stay in there until it stops draining. Now, once it stops draining, slowly pull it out, so that sometimes there could be a little beyond the tip of the catheter. You might be up higher than the urine. So pull it slowly so it completely drains. Now, let me get my catheter out here and kind of show you what I was talking about. So this is a non-lubricated catheter. So this other tip here is the one that goes inside you. Get it by my shirt so it shows. And then this is the end that goes out to drain. The whole trick to doing this is to get it lubricated. I would lubricate for a man. I would lubricate probably at least that much. You want to have the slipperiness. So what you're going to do is you're going to insert it into the penis. You washed your hands and everything, so don't worry about touching it here. and you want to just gently push. And it's kind of a push. I always say if you push it right up to the head of the penis, and then come back and grab another section, push to the head of the penis, come back, grab another section, push to the head of the penis, and eventually you're going to start to see it's clear, so you'll see the urine coming through. Once you're there, you're in. I always say, if you see urine, you're in. All right. Now, for women, locating the urethral opening, that may take a little practice. It's not completely something that most women are normally looking at to be able to see. Now, if you've never looked down there, a hand mirror is not a bad idea to try to kind of familiarize yourself with your anatomy. So up on the very highest point is the clitoris. It's just a sensitive part. You'll be able to feel it. If you touch it, you'll know it's the clitoris. It's very sensitive, but there's no opening to you can catheterize. The meatus, which is the urethra, is below that. You can see, right, it shows there. It's kind of difficult sometimes to visualize that in a normal anatomy, but it's below that, so that's one hint. And if you go too far, you're going to be in the vagina, so you want to come back up. A lot of times, if it's really a problem and you're trying to catheterize yourself and you keep going into the vagina, you can put a finger there to try to block it so that you're going right above your finger. So you're going to get lots of these tricks. I will tell you right now, for women, if you do it blindly, once you feel what it feels like to catheterize the urethra, you'll work on a feel method. You'll never miss. It's just one of these things. You get that muscle memory of where to put the catheter. A little tricky at first. Mirrors are good for learning your anatomy, but when it comes to catheterizing, if you've never worked with the mirror before, up is down and down is up and sideways, it really gets confusing. So I don't teach with the mirror. I just think that if you're sitting on the toilet, you can just use an upward motion. And by that, I'm just going to grab my catheter real quick here. So you don't want to be catheterizing down. You want to be catheterizing up. So that upward motion will get the catheter to go the right way. Now, that's the full-size catheter I was showing you for a man. The female catheter is a little smaller and easier to handle. So for women performing intermittent catheterization, start by cleaning the area around the urethral opening, always wiping from front to back to help reduce the risk of introducing bacteria into the urinary tract. Gently insert the lubricated catheter, same thing, all the same procedures, and slowly advance it about 3 inches until urine begins to flow. Now, ladies, this will sound a little gross, but I find most women find that if they kind of put their finger, I'll get my catheter up here again, like this is the end that's going to be coming out. Yours will look pretty similar to that. If you kind of get a finger, you'll feel the urine coming out. I know it's gross, but sometimes it's harder to tell if the urine's coming out. You don't always hear it hitting the water because of the catheter. But anyway, until you start to get the flow of urine, then you leave it in till it completely empties. If it stops, you can sometimes push it up a little bit to see if more comes out and then pull it out slowly until you no longer have the catheter in. That's simple. Now, preventing infection during intermittent catheterization starts with consistently keeping your bladder empty by catheterizing as you're told, usually 4 to 6 times if you're not able to urinate at all on your own. Good hydration is also important. Water flushes the bacteria out of your system, so that's really important. Hey, here's a hint. Do you know that intermittent catheterization actually has a very low infection rate? Who'd thought? Here you are catheterizing yourself, you think you'd be causing infection. Much lower infection rate. If you're wearing a catheter, every catheter that you have within a week will cause an infection. Now, it's one you can tolerate. I'm not saying it's something that you need to treat with antibiotics, but you will get bacteria that you shouldn't have in your bladder because of that. They can climb up that catheter, but very low risk with intermittent. Always use a new sterile or single-use catheter every time, and follow the instructions with the good soap and water procedure for cleaning your hands. That's the most important way to prevent infection. Some people think putting the gloves on, but it's not a replacement for good old hand washing. Now, what do you need to worry about? Well, it's important to recognize early signs of a urinary tract infection so you can seek treatment properly. Contact your healthcare provider if you develop a high fever. I say something over 100 degrees Fahrenheit. You'll feel like crap. Chills, nausea, body aches, all these things indicate the infection. Other warning signs include lower back or abdominal pain, cloudy or dark urine, foul smelling urine, and noticeable changes in the color of urine. Should also report bright red blood in the urine or blood clots. Now, a little bit of blood when you catheterize yourself is not unusual, especially us men who are catheterizing around a prostate. It's a pretty vascular organ, and sometimes it will bleed a little bit. But if it's getting to the point where you're passing heavy clots after you take the catheter out, call your doctor. Now, here's another hint. If you're traveling with an intermittent catheter, it's very manageable and with a little pre-planning. Be sure to pack more catheters than you think you need. What happens if you drop one, you know? So always pack more. Along with the lubricant, hand sanitizer. This is where it's nice to have those throwaway wipes. Disposal bags in case you have to catheterize on the go and you want some way to get rid of it. An organized travel kit you can easily access. Keep your supplies in your carry-on when you fly. Don't put them in the lower part of the plane. Who knows? You know, I've gotten stuck on the gateway waiting for the plane to take off for over an hour sometimes. It could add on the time you haven't figured out. Bring a letter from your healthcare provider if you need to explain medical supplies at security checkpoints. I've never had a patient ever ask for that. I've never had a patient have issues flying, so they're pretty used to seeing that kind of supplies. Try to maintain your usual catheterization schedule as much as you can. Always wash your hands, sanitize before each catheterization. Use a clean surface, disposable barriers. Maintain hygiene in public or unfamiliar restrooms. Some of these catheters even have sticker type bags that you can stick it to the door so that you can have a place to hold the catheter while you're working. So lots of things that you can try. So intermittent catheterization may feel challenging at first, but with practice, it becomes a simple, effective part of your daily routine that helps you stay healthy and in control of your bladder function. Remember to follow the catheterization schedule, maintain good hygiene, watch for those signs and symptoms of infection, and reach out to your healthcare provider with any concerns or difficulties. Over time, most patients gain confidence and independence with this technique, and small adjustments can make a big difference in comfort and success. All right, there you have it. Hopefully that was a nice refresher for some folks. Maybe learned a few tips. Maybe you're wearing a catheter right now and you are thinking about, boy, it'd be nice not to have to run around these hot days with that bag on your leg. Try intermittent catheterization. I've had no patients in my entire career that I talked into trying it. I've had a few I couldn't talk into it, but everyone who's tried it stays with it. They don't want to go back to the bag. So that's a good hint. Hey, next week coming up.
Episode of UroPatient, hosted and presented by Vic Senese. We explore what life is really like after a radical cystectomy, also known as bladder removal surgery. This major urologic procedure is often performed for muscle-invasive bladder cancer and other advanced bladder conditions, and it can be life-changing for patients and families. Understanding what comes next after surgery is just as important as the procedure itself. In this educational discussion, we break down the recovery journey, long-term adjustments, and practical strategies for adapting to life after bladder removal. Join us on July 25th at 10:30 a.m. Central Time to learn more.
Yeah, I hadn't talked about that one before, and I started thinking, there's patients still that have to have an entire bladder removed. We're able to save a lot of bladders these days by getting to them early, but sometimes patients come in and their tumor's already gone through the bladder wall. And really the only option to save your life is to remove your bladder. And you're going to have something to deal with because you don't have that natural, storage organ anymore. So we're going to talk to you about what you can do. Again, once you have the information, it's a lot easier to deal with. So don't panic. Tune in next week to learn more about how you can take care if you lose your bladder, what you're going to need to do. And maybe you want to watch just so if you're a smoker, you don't want to lose your bladder because you'll see what you'll have to do. And the rest of you guys, just enjoy your rest of your weekend, and we'll see you next week on UroPatient.com.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient. The podcast is here.